Good afternoon, everyone. This is Steve LeBlanc, Chief Strategy Officer for Dartmouth-Hitchcock Health, and welcome to our Health Policy Grand Rounds with Congressman Peter Welch from Vermont. So thank you for joining us. We're pleased to welcome Congressman Welch as part of Dartmouth-Hitchcock's We Care, We Vote initiative. We Care, We Vote is a nonpartisan voter education initiative designed to educate and empower Dartmouth-Hitchcock Health employees to participate in the electoral process by voting in the 2020 elections. All candidates for federal and statewide office have been invited to participate, so we look forward to opportunities to hear from them in the upcoming weeks. Congressman Peter Welch is running for his 7th term representing Vermont in Congress, where he currently sits on the very important Energy and Commerce Committee, which has jurisdiction over many federal health programs. Congressman Welch lives locally in the Upper Valley, where he founded a small law practice and also served in the Vermont State Senate. We look forward to hearing some remarks from Representative Welch, and then we will open it up to questions from the participants. As you listen, please feel free to submit questions using the Q&A function. Thank you all again for attending, and I'll turn it over to Congressman Welch.
Thank you very much, and I really appreciate DHMC hosting me and I guess other colleagues as well. You know, a couple of things. First of all, I want to thank DHMC, and I want to thank all the healthcare workers for the extraordinary service that you've provided under incredibly demanding circumstances. I mean, whoever would have thought back in March when we shut down that we would be dealing with what has become an extraordinarily serious crisis with this global pandemic. And it's the first one that we have had at this scale since 1918. And it is so astonishing what the world is like now versus what it was back then. You know, I remember coming back from Washington, I think it was March 13th, where we had just passed the first coronavirus bill, and it was a tiny one by relative standards. But when I came back to Vermont and flew into Burlington and then went down to Norwich, where I live, there was nobody on the highway. The governor had declared the emergency. And that's when our hospitals had to essentially stop doing so-called elective procedures. And of course, elective procedures were things like knee surgery or hip surgery or back surgery or all the things that most of us, when we need it, don't regard as elective at all. It really is important. And the revenues that you depend on by providing services totally collapsed. And then you all had to scramble for the PPE, and you didn't know whether you had the ventilators. And we were just contending with the incredible unknown at that point about how the virus spread. And the people who had to show up at DHMC were the ones who had to do it, where everything in our society was talking about how incredibly contagious it was, but we didn't really know how it was spread. And if you remember back then, we thought if you touched a doorknob, you'd die. You know, it was really, really serious. So I want to salute you, and I think all of us who have benefited by the fact that you stayed on the job and were there to serve us, and then to observe and to make adjustments and to learn about the disease. We're very, very grateful. The biggest challenge we face right now continues to be to get the virus under control. And, you know, the two things have happened. One is the virus, and it's been brutal in this country. And it's, in all candor, I think it didn't have to be that way. But we have lost, as you well know, about 220,000 lives and 8 million infections. And it's a real indication of at the federal level, there has been a failure to have a consistent approach to addressing the virus and arresting it that other countries have had. You know, we have 4% of the world's population, and we have about 24% of the world's COVID deaths. That's not a record we should be proud of. That's at the national level. The state of Vermont, we're pretty proud, New Hampshire too, Governor Sununu and Governor Scott have taken this very seriously. They've had consistent messaging. Vermont, we have the lowest infection rate in the country, and New Hampshire has a very low infection rate as well. So it's tremendous that the two states are partners in this. But the economic fallout of this is just it's brutal. And we have the highest unemployment rate since the recession, or since the depression. We had 5 million people who lost their job in the blink of an eye, and with it, they lost employer-sponsored health care and are having real difficulties getting access to Obamacare, and the expenses of it are real. A lot of folks, including many I suspect who work at DHMC and frontline jobs, are having to contend with their kids. How do you educate them? You know, they're going, quote, back to school, but it's a hybrid model. And for several months, the schools were closed. So again, I just want to acknowledge the effort and the sacrifice and the resilience of a lot of folks who work at DHMC, and my gratitude. But the federal level, our job is really pretty simple. It's to get funds and resources back to the communities. That's it. And it's always contentious in DC, unfortunately. The first CARES package that we passed was the triumph of bipartisanship. Senator McConnell and Speaker Pelosi, who seldom see eye to eye, essentially negotiated a $2.2 trillion package. It helped our small businesses. It helped individuals with unemployment and that $1,200 check. It helped our medical community with payments to hospitals. Not enough, but it did stabilize things. That's run out. And what I'm seeing is that those businesses that can work from home, they're doing okay. But there are so many Vermonters and folks in New Hampshire that work like in the restaurant industry, the hospitality industry, where it continues to be really tough. And the ability to go back to work in many of those industries won't really be secure until people feel safe and secure when they come, whether it's to the Hopkins Center for a performance or it's to Lou's restaurant. You know, they're making accommodations, but that's the challenge. So my view is that the federal government has to continue to provide help. In the House, we did pass the so-called HEROES package, but essentially what that did was provide more money for small businesses, like the payroll protection plan, extended unemployment to help people be able to pay the rent. It provides significant funds to our states and our municipalities, and I think that is absolutely critical. In Vermont, we've been able to use some of that money to help some of our smaller businesses and some of our medical community. And I like there to be flexibility, because I think some of those allocation decisions are better made in Montpelier and in Concord than they are in Washington. So my view is that it's not time to tap the brakes. It's time to keep going ahead. Now, the next thing, of course, is we've got an event coming up on November 3rd. And the American people are going to make a decision about whether they want to change our course or they want to continue with what we've been doing. Obviously, my hope is that we make a change. But what I want so much is that if we do make a change, we address some of the shortcomings that we have in our society that have been exposed as a result of COVID. You know, what this did to our businesses, to our medical institutions, was beyond the control of anybody. It's not an issue of good or bad management. It's not an issue of a good or bad product for some of our small businesses. It's not with individuals. It's not as though they were working hard if they weren't. If they can't pay the rent, we don't have the revenues to keep the businesses afloat. There's enormous financial pressure on our medical institutions. That's all a result of COVID. And the one governmental entity that has the fiscal flexibility and capacity to really help is the federal government. So that's our job. But I'd like to see us start to address the need to have social insurance programs that do provide some help to people when things beyond their control happen, like paid family leave and medical leave, like childcare, that's affordable and accessible for folks who have to work. And like healthcare, where you don't lose your healthcare when you lose your job. So those would be big challenges, but I think they're essential challenges that we face when we get back to Washington. So I'm going to stop there and open up for questions and end where I began with a thank you to the tremendous work at this extraordinary institution that we're blessed to have in the Twin States.
Thank you very much, Congressman. And Courtney Tanner from our Government Relations Office is monitoring any questions that come in, and she'll be interrupting when we get some of those. But I'd like to kick it off with one, Congressman. The waivers and flexibilities that were put into place by HHS and CMS during the pandemic remove some of the regulatory barriers and enable providers at Dartmouth-Hitchcock Health and elsewhere to continue to provide patient-centric care, specifically through things like enhancing our telehealth services.
Right.
What steps would you take to ensure that Medicare continues to cover telehealth to patients in their home? Also, what efforts will you make to ensure that audio-only visits are continued to be covered, especially in rural areas, even once the public health emergency has passed?
Well, thanks for that question. Number one, as you know, I'm the head of the Telehealth Caucus. It's been something that those of us in rural parts of the country have been pushing for a long time. Number two, we had a big argument before COVID about the merits of telehealth, its efficacy and fairness. We don't have that argument anymore. Telehealth has been tremendously successful for providers and for patients. I had a telehealth visit when I did something stupid around the house and poured hot coffee, scalding coffee on my foot. Don't ask. But it was great. I was able to talk to my doctor, show him my burned up foot, and get the peace of mind from a good medical visit, and we took care of it. So what's happened now with COVID, where in fact we couldn't have face-to-face and visits, is that the efficacy of that as a procedure has been demonstrated. So whereas pre-COVID, I and my colleagues who were in the Telehealth Caucus were trying to convince people of its merits, we don't have that burden anymore. The second thing, resistance to telehealth was to some extent, will people run the clock or run the meter? Will it cost too much? Well, you know, that's a fair question, but it's not a question that you only ask when the delivery mechanism is telehealth versus inpatient. I mean, that issue of accountability is always there. And then the third thing is that it's really been popular with patients and with doctors. And what I've been, it's got to be in its place, because obviously there are times when you've got to be in person, but there's times when you really don't. And what I have heard from from many of my folks who treat patients is that in mental health, it's also really good. And in some cases, it's a more intimate visit. So I think we're going to be successful in having telehealth institutionalized as a part of the delivery system.
Great. Thank you, Congressman. Vermont, like other largely rural states, relies on an increasingly fragile network of rural hospitals and other healthcare providers. What will you do to help sustain access to high quality healthcare in rural markets like Vermont that are where those hospitals are under significant financial pressure, difficulty recruiting workforce, et cetera?
Well, two things. First of all, you are absolutely right. Vermont's the most rural state in the country, and our local hospitals are under enormous pressure. And I think it's two things. One, if we have a healthcare system, how do we have a healthcare system that meets the needs of people if those of us who live in rural parts of the country don't have access to the care we need? So it starts with a fundamental commitment. By the way, similar to the kind of commitment we have to broadband. And broadband, as you know, is also critical to that telehealth, okay? But second, and this is where I think there'll be a lot of discussion in the next Congress. What's the model? What's the delivery model? Because there's some things that you can do out in a smaller, rural setting, but there's some things that you can only do in a tertiary care setting. So how do you create these relationships in a model where it is appropriate for what services can be better provided in the community versus what services can be better provided in a tertiary care institution like DHMC? So that's got to be, I think, part of the discussion. And who better to be engaged in that than DHMC, given the affiliations that you have with many of our hospitals that are in the more rural parts of Vermont and I think New Hampshire.
Thank you, Congressman. Vermont is kind of bracing itself for a silver tsunami with the aging population similar across New Hampshire and Maine. And it's imperative for Vermont to attract and retain young professionals, not just in healthcare, but across all sectors. How will you work to attract and retain young professionals and their families to stay in Vermont and come to Vermont?
Well, interestingly enough, COVID is doing a lot of the work there. No, that's really true, because what we're seeing is that there's a lot of folks who are having second thoughts about wanting to be in urban areas. And if they can come to Vermont and New Hampshire, that would be fantastic. And of course, a key to that is high-speed internet everywhere. Okay, that has to be part of it, because that gives an option to people who are in a situation where they can work from home to be able to do that. So I think that's one thing that is really, really essential. But I think the building blocks, so I think that's a dynamic that's happening. I mean, we're reading about the real estate market. I get that's good and bad. It's good in the sense that we've got people coming up here who can be contributing citizens. It's bad in the sense that it may be escalating the cost of housing for a lot of folks that are here and have good jobs, but can't afford to compete with big city pocketbooks, really. But I think a key here is definitely high-speed internet throughout rural America. And that's an area where there is bipartisan support. You know, when I talk to my Republican colleagues about their local hospital, they describe identically the problems that I experience with our rural hospitals in Vermont. When I talk to them about broadband and what a hassle it is and how kids are literally sitting outside of some restaurant or the library because they're doing their homework. Well, that was last year. This year they had to do their schoolwork, not their homework, everything. All right, so that's where there's some real potential for common ground. And that's my hope here. You know, everybody's this when I look at what happened and the challenge we face in America, in the solutions that are required, they have nothing to do with red state, blue state differences. I mean, if you're in Indiana and you have small rural hospitals, you're concerned, the people you represent, it's identical to the concerns of Vermonters that I represent. And even in these big relief packages, we're talking about unemployment benefits, whether you're a Republican or Democrat, you're out of your job and you got rent coming, you need some help. If you're a hospital in a red state or a blue state and you haven't been able to essentially do elective procedures, you need some help. So there's a potential here for there to be unity because the help that's needed in Vermont is not different than the help that's needed in Indiana or Nebraska or Oklahoma. So a lot of my effort will be to focus on those common challenges that we face and try to find common solutions.
Thank you. Courtney, do we have any questions from the attendees?
We do not have any questions just yet, Steve.
Okay. Congressman, researchers at Dartmouth-Hitchcock are proud recipients of many federally supported research grant programs, including NIH and the Agency for Healthcare Research and Quality, the Centers for Disease Control and Prevention, and Patient Senate Outcomes Research Institute. Will you be an active champion at the federal level to ensure that there's robust federal funding available for medical research?
Now, are you pretending that's a hard question? You're throwing me some softballs here.
Yeah.
Of course, I mean, we've got to have research. You know, we have, first of all, there's an immense amount of research, as you know, going on with a to try to get a cure or a way to deal with COVID and the vaccine. But one of the commitments we have to make as a government that is about serving people is a basic confidence in the importance of basic research, not just applied research, but basic research, where it's just about trying to understand how systems work or how life is formed. I mean, that basic research is like pure intellect that then in ways that you could never imagine lead to discoveries that then lead to that next step of application. And I believe that the record is very clear that societies that do make that confident investment in research for its own sake reap the rewards. So yes, I will be a strong proponent, as my colleagues in Vermont, Senator Leahy and Senator Sanders, and my colleagues in New Hampshire, with your delegation, will be all there.
Great. You had mentioned earlier that and it's true that Vermont and New Hampshire have had a lower incidence rate of COVID, but we all suffered from the lack of a solid distribution and availability of PPE earlier in the crisis. Now looking forward, if a vaccine becomes available, how will you ensure that states like Vermont and New Hampshire will get access to those vaccines in a reasonable amount of time, knowing that there's been some talk about targeting sort of the harder hit areas of the country, which makes some sense, but worried about availability for
Right.
our states?
Well, a couple of things. Number one, this is one area where I think the federal government is anticipating this problem. So there's going to have to be prioritization. And how ethically and fairly do we make the prioritization list? Who gets the vaccine first? And my understanding is that most folks believe that those who are most vulnerable should be first in line. And that obviously is folks in nursing homes, older people, probably people with prior conditions. Second, there's an awareness that we have to make certain that our frontline workers who are most exposed have access to it. So I think that prioritization discussion is taking place now, and obviously that has to be pinned down. The next point is that the federal government is spending money with companies to create the capacity to essentially manufacture the to be determined vaccine in vast quantities and spending that money up front. So it's not as though we'll wait for the conclusion that this vaccine works, it's safe and effective, and then we'll ramp up production. What I understand is that the production capacity there is being ramped up as we speak in anticipation that there will be a vaccine to be produced. So the more money we spend up front to have that ready to go at the flip of a switch, the sooner we're going to be able to distribute the vaccine. And that where we distribute it, I mean, that has to be obviously equitable as well, not just who's got the governor that's closest to whoever the president is. So, and I expect that will work out. I think the big challenge will be A, getting the vaccine, and B, having a capacity to manufacture it and distribute it in advance. One of the challenges with that, by the way, and FedEx and UPS are really working on this, is some of the vaccines under consideration have to be stored at extraordinarily low temperatures. It's not like you just stick it in your refrigerator, and you probably don't have the capacity at DHMC to do it. So all of that infrastructure is being constructed now in anticipation, so that we don't have that delay between the vaccine and its administration.
Steve, we do have a couple of, thank you very much, Congressman. We do have a couple of questions coming in from the audience. I know the time is ticking down. One of the questions is about the livable wage, and we're working between two states where one state is taking the lead and the other state is not necessarily having the conversation here in Vermont and New Hampshire. What is the federal conversation on livable wage, and what work do you plan to do around a livable wage, Congressman Welch?
Yeah, that is a problem. You know, we got that Connecticut River, and we got Vermonters going over to New Hampshire to buy things because there's no sales tax, and we've got a much higher minimum wage, I think, in Vermont than we do in New Hampshire. Federal level, I'm supporting a $15 minimum wage, and we've passed a higher minimum wage in Washington, but in the House. It's died in the Senate. I think that'll change depending on the outcome of the election. I think that'll change. If we have a new Senate, a Democratic Senate, it's going to be taken up legislation that has been passed in the House, whether it's on the minimum wage, climate change, prescription drug price negotiation, a lot of things that are very popular among Americans in both parties. I think we'll have a chance to work on that. I mean, I'm very excited about the potential to be able to actually get things done, but the minimum wage, I think, would be increased federally. It hasn't been increased federally. It's $7.25 now. It hasn't been increased in, I think, decades.
Courtney, do you have another question? Maybe our last question?
I do. Sure, I have, this might be a great last question. So individuals are experiencing COVID fatigue, and people just want to go back to normal. What are your thoughts on how to help people as we all are a little tired of staying cooped up in our homes and struggling with going back to work? How can we deal with protective measures? And
well, include me in that group. You know, this is hard, okay? And the biggest incentive for us to try to work through our fatigue is our awareness that somebody we love can get sick, and our awareness that we want to take care so that we don't let someone else get sick. But it's harder. It's definitely going to be harder. You know, we had beautiful weather this summer, and my family was home, and we had a couple of kids home who work in other cities. And we all worked during the day, and we had nice meals out on the patio at night. And it was a really wonderful time to be with family. I feel very fortunate that I can say that and I experienced that. But we're losing daylight savings time. Days are getting colder. We're not going to be outdoors as much. And it's been going on for 7 months now. So bottom line, it is hard. It is hard. But
so what are you doing, Congressman, to stay safe? What precautions are you taking personally?
Well, I continue to social distance, wash my hands, and wear a mask. I mean, the things that we know we're supposed to do, but I think it's really kind of an emotional question. What can we do to try to keep ourselves together? So some of my friends, every once in a while, you know, we'll build those fire pit visits and meet outside. My wife and I are really becoming Netflix devotees. I'm trying to exercise a little bit more. I want to get outside. So all of us have to try to find some ways to do that. You know, for me, I'm trying to make a phone call to like a family member every day, just a different one, and maybe to call a colleague every day and just check in and say hello. But it requires effort. You know, it's like being self-conscious. The worst thing we can do is like get into woe is me. It's objectively hard, but it's not an answer for us to disregard the safety requirements. We know that. So we're just doing our best to maintain the really simple things that are the ones that are more effective. You know, wear the mask, wash your hands, social distance. But bottom line, it is hard. And I think the most important thing for that is to remember that however it is you're experiencing it and how frustrating it is for you, that's how it is for other people. And if you acknowledge that, it gets you outside of your own head and out of your own way. And I think it's the best survival skill. So just a few thoughts from Vermont.
Well, Congressman Welch, thank you very much for joining us, your remarks and answering some of the questions. We'll promise to make them harder next time.
Thank you.
Have a wonderful day, and
Yep.
thank you all
Yeah.
for attending.
Thank you.